Hey, good afternoon. It's Dr. Leslie Wakefield, Pelvic Floor Physical Therapist. And I'm coming to you today from the car. It's just outside the office because I'm running late, which is kind of as usual these days. The question is about constipation. Can pelvic health or pelvic floor physical therapy help with constipation? We talk about urination all the time. I talk about sexual function all the time. And yes, pelvic floor physical therapy or pelvic health PT can also help with constipation. Let's talk about the behind of the why of that, and then we'll go to specifically how it can help. The reason pelvic floor PT can also contribute to treatment of constipation is that those muscles, the muscles of the pelvic floor, contribute to or control urination, defecation, which is pooping, and sexual function, in addition to coordinating with the other core postural muscles and supporting the organs against gravity and working with the respiratory diaphragm as you breathe to control pressure mechanics. When we think of the most basic fundamental functions, pee, poo, and sex are the things that come to mind first. So when the muscles contract, that is what holds in your pee or your poo. And when they relax, ideally, that would permit urination or defecation, that would permit the bowel movement to come out. And one way that someone might experience constipation is difficulty relaxing muscles to get the poo out. And that would be called outlet obstructive constipation or functional constipation, paradoxical contraction. There's various names that you might hear that refer to that, but the idea is instead of relaxing to allow poop to come out, the muscles might actually contract, and you might not even be able to feel the difference. So people end up straining and pushing and pushing. Maybe they get hemorrhoids, they might get prolapse, there might be pain or even bleeding with defecation, and the problem is actually that the muscles aren't letting go. The muscles are having trouble responding to those right cues to be able to relax and let the poop out. So part of pelvic floor PT can be retraining those muscles to do their job better. One of the jobs is to hold. One of the jobs is to release. The opposite side of that would be fecal incontinence or smearing, or like you clean yourself, but there always seems to be a little something left on your underwear later. And that's a little bit of the opposite problem. Maybe those muscles need to learn how to hold better. In the case of constipation, one way that pelvic PT can contribute is to make sure your muscles are relaxing completely. And a challenge to that is if you are having to generate some pressure, if you are straining a little bit or pushing a little bit, as that pressure goes down and is trying to help the poop to come out, sometimes the pelvic floor will actually instinctively sort of resist that and clench up. And so it may be a simple issue if you can't relax enough. It might even be that the muscles are working against you and contracting against you. But we would be able to evaluate that in our practice, and most pelvic PTs can, depending on their area of specialty and what their interests are. You might also be diagnosed with that particular problem by your doctor, by a GI or a proctologist, and then they might refer you to pelvic floor physical therapy. So then if that's the reason that the pelvic floor can contribute to constipation, and we understand that you can come to a pelvic PT and we can diagnose that and then help treat it, what would we do in treatment? And some of that is working with mechanics. Some of that would be, for example, recommending a squatty potty or wanting to know the height of your toilet compared to how tall you are. Somebody who's really, really tall has a low toilet might not need a squatty potty, might be pretty uncomfortable. Most other people we are recommending it to, but it's not 100% of the time for everybody. We would teach you about correct posture when you're sitting on the toilet, correct breathing mechanics and breathing techniques to help facilitate the pelvic floor to relax and to help you generate a little bit of functional pressure without straining or risking hemorrhoids or risking prolapse, like doing it in a safe way that's good for your body. We would want to check, of course, on generalities in terms of, are you drinking enough water? In general, do you have enough fiber in your diet? Is it soluble and insoluble? Depending on the pelvic PT, they may touch on that if that's within their knowledge base. There are electrical modalities that can be used to help stimulate the gut, like by putting pads on the stomach. to help stimulate some of that peristalsis over time. We can do something called biofeedback, which is where you get information on what your muscles are doing so that you learn to control them better. And one type of biofeedback that's very common that you'll find is EMG biofeedback, where we actually put sensors either on the outside around your pelvic floor, which would be around your anus and your groin, or even internally. We can put a sensor either vaginally or rectally so that we can get exactly the information on what those muscles are doing. And we can use that information to help you to learn to feel it better and then to control it better. If there's trigger points or tightness in the muscle, we can certainly release that manually, either externally or internally with your permission. We can teach you how to do different breathing techniques to facilitate relaxation, whether you're on the toilet or not. There's a lot of ways that we can contribute, and the nice thing is when we work with the pelvic floor, let's say we're working with helping you to relax, to defecate, that might improve other things too. You might not realize, but having that tight pelvic floor muscle is also contributing, for example, to some pain with sexual function, or decreased orgasm, or maybe a sensation of incomplete emptying of the bladder or urinary frequency. A lot of times these things sort of come together, and because it is one group of muscles that contributes to so many different areas of function. If those muscles are not working well in one area, a lot of times they're also having trouble in other areas too. So we end up treating the whole picture and improving not just defecation, but maybe also urination, maybe also sexual function, maybe also you feel like, oh my God, my back pain got better because we're improving the mechanics of your deep core muscles and your deep hip muscles. So there's a lot that pelvic PT has to offer. And if constipation is something that's bothering you, we can evaluate it, either us or your MD. And then come up with a plan for you. If it's something unrelated to pelvic floor, your PT will certainly tell you that, and then you can move on to maybe looking at nutrition and other things. But I thought that was a great question, because it's not, everyone thinks of pelvic PT as for, holding in urine. Oh, I'm leaking, so I need to go to a pelvic floor physical therapist. And that's definitely a lot of people that come to our office. But constipation is another big one, and it affects men and women and children. And we all have pelvic floors. Everybody has a pelvic floor, and if it malfunctions, everybody's going to experience that in a different way. So, as always, thank you for listening. If you liked, please like. If you want more, please follow. And if this helped you to think of a question that you'd like to be answered, I would love to answer it for you. It helps me to get ideas for content. So you can submit your questions through Facebook. I'm going to post this on YouTube. Let me know what you want to know, and I'll make sure to cover it next time. See you then.